Birth control pills. Birth control pills, also called oral contraceptives, are medications you take by mouth to prevent pregnancy. They're an effective method of birth control. A series of events called the menstrual cycle happens about once every month to prepare a woman's body for pregnancy. Changing levels of natural chemicals in the bloodstream, called hormones, control these events. The reproductive organs affected by these hormones include the vagina, cervix, uterus, fallopian tubes, and ovaries. The ovaries produce two main hormones called estrogen and progesterone. As the level of estrogen begins to rise, it causes the normally thick mucus inside the cervix to thin out. Estrogen also triggers other hormones to cause one of the ovaries to release an egg. This process is called ovulation. If a woman has sex during this time, a man's reproductive cells, called sperm, can pass through the thinner mucus to fertilize an egg in the uterus. Estrogen causes the lining to thicken, in which it prepares to receive a fertilized egg. Rising progesterone levels cause glands in the lining to release fluid that feeds the fertilized egg. Progesterone also causes the thinned out cervix to become thin again, which prevents sperm from passing through. If an egg hasn't been fertilized, the levels of both estrogen and progesterone begin to fall. This drop in hormone levels causes menstruation, a process where the uterus sheds its inner tissue lining and blood through the vagina. What are the types of birth control pills? Combination pills contain synthetic, man-made forms of hormones, estrogen and progestin. Most pills in each cycle are active, which means they contain hormones. The remaining pills are inactive, which means they don't contain hormones. There are several types of combination pills. Monophasic pills. These are used in 1 month cycles, and each active pill gives you the same dose of the hormone. During the last week of the cycle, you take inactive pills and have your period. Multiphasic pills. These are used in 1 month cycles and provide different levels of hormones during the cycle. During the last week of the cycle, you take inactive pills and have your period. Extended cycle pills. These are typically used in 13-week cycles. You take active pills for 12 weeks, and during the last week of the cycle, you take inactive pills and have your period. As a result, you have your period only 3 to 4 times per year. Progestin-only pills contain progestin without estrogen. This type of pill is also called the mini pill. Progestin-only pills may be a good choice for women who can't take estrogen for health or other reasons. With these progestin-only pills, all pills in the cycle are active. There are no inactive pills, so you may or may not have a period while taking progestin-only pills. How do birth control pills work? Combination pills work in 2 ways. First, they prevent your body from ovulating. This means that your ovaries won't release an egg each month. Second, these pills cause your body to thicken your cervical mucus. This mucus is fluid around your cervix that helps sperm travel to your uterus so it can fertilize an egg. The thickened mucus helps prevent sperm from reaching the uterus. Progestin-only pills also work in a few different ways. Mainly, they work by thickening your cervical mucus and by thinning your endometrium. Your endometrium is the lining of your uterus, where an egg implants after it's fertilized. If this lining is thinner, it's harder for an egg to implant in it, which will prevent a pregnancy from growing. In addition, progestin-only pills may prevent ovulation. Factors that affect your choice of use include your menstrual symptoms, whether you are breastfeeding, your cardiovascular health or health-related issues, other chronic health conditions you may have, other medications you may take, how to use birth control pills. Combination pills come in a variety of formats. These include monthly packs, which follow either 21-day, 24-day, or 28-day cycles. Extended regimens can follow 91-day cycles. For all of these formats, you take one pill each day at the same time of the day. Progestin-only pills, on the other hand, can come in packs of 28. As with combination pills, you take one pill at the same time every day. How effective are birth control pills? If taken correctly, birth control pills are very effective in preventing pregnancy. According to the CDC, both the combination pill and the progestin-only pill have 9% trusted source failure rates with typical use. That means out of 100 women using the pill, 9 would get pregnant every year. To be fully effective, progestin pills must be taken within the same 3-hour time period every day. There is slightly more flexibility with combination pills. Certain medications make either type of pill less effective. These include rifampin, an antibiotic, certain HIV medications such as lopinavir and saquinavir, certain anti-seizure medications such as carbamazepine and topiramate. The pill also may be less effective if you have diarrhea or vomiting. If you've had a stomach illness, check with your doctor to see if you're at risk of pregnancy. Use a backup method of contraception until you know it's safe not to do so. Benefits of birth control pills. They protect you 24/7. You don't have to worry about birth control during intimacy. They're effective. They protect against pregnancy better than most other birth control options. They help regulate your menstrual cycle. This can be helpful for women with irregular or heavy periods. They are fully reversible. This means when you stop taking them, your cycle will return to normal and you can get pregnant later. Disadvantages of birth control pills. Birth control pills don't protect against sexually transmitted infections. To make sure you're protected against these infections, you need to use condoms in addition to your daily pill. Also, you have to remember to take your pill every day, and you need to make sure you always have a new pack ready to go when you finish a pack. If you miss a pill or delay starting a new pack after finishing a cycle, your risk of pregnancy increases. Side effects and risks. Decreased sex drive, nausea, bleeding between periods, breast tenderness. Risk. A serious risk of using birth control pills, especially combination pills, is an increased risk of blood clots. This can lead to deep vein thrombosis, heart attack, stroke, pulmonary embolism. Talk with your doctor. Which type of birth control pill might be better for me? Am I taking any medications that could cause problems with the birth control pill? Am I at higher risk of blood clots from the pill? What should I do if I forget to take a pill? What other birth control options should I consider?